Hello everyone. Today we are going to learn about application of Pessary. I'm Vinoli, lecturer from Tibulam College of Nursing. Let's get on to the video. Objectives of the topics. At the end of the class, students will be able to understand about definition of Pessary, types of Pessary, insertion of Pessary, removal of Pessary, benefits for Pessary, and care of Pessary. Let's understand what is Pessary. A pessary is a prosthetic device that can be inserted into the vagina to support its internal structure. It is often used in the case of urinary incontinence and vaginal or pelvic organ prolapse. A prolapse occurs when the vagina or another organs in the pelvis slips out of its usual place. The supports a pessary provides can help a woman to avoid a pelvic surgery. So, if people having pelvic organ prolapse, you may feel an unpleasant fullness in the vagina, and from the organ that slips down it out, and with severe prolapse, you may feel able to feel the organ poking out of your vagina. Sometimes, if people with the stress incontinence, you may have accidents when you laugh, cough, and sniff or exercise. In most of the cases, the people choose pessary when they want a symptoms relief but want to avoid surgery to fix their pelvic floor muscles. Or sometimes you may choose a pessary if you have a medical problem that makes surgery too risky. Or sometimes a pessary is an option of other conservative things. Coming to types of pessary. The pessaries comes in different shapes and sizes. Most are made of safe and non-absorbent soft silicone method. The two most common types of pessaries are ring pessary and gel-con pessary. Let's see the ring pessary. This is O-shaped pessary. This is one of most healthcare provider recommended for treating stress incontinence and mild to moderate pelvic organ prolapse. And they come in different varieties of pessaries, so providers can pick up the versions that's best for you. Gel-con pessary. A gel-con pessary is usually the go-to options for advanced pelvic organ prolapse. This pessary is disc-shaped with a knob in the center. A gel-con pessary is called a space-filling pessary. In addition to providing support like the ring pessary, gel-con fills the space in the upper part of your vagina. It creates a barrier that prevents the pelvic organs from slipping into your vaginal canal. Your healthcare providers may fit you for the other types of pessaries like Shards pessary, Herher's pessary, and donut pessary. Swords pessary, which is a disc-shaped structure like the gel-con pessaries, but without the knob will be present. And K-con's pessary is a U-shaped structure with its rubber membranes, and especially useful for treating the prolapse involving and uterus or bladder. And the donut pessary is like the ring but thicker, often used as an alternative to the gel-con pessaries. Cube pessary. Cube pessary, but the concave sides of suction to the sides of your vaginal walls, and often used as an alternative to the gel-con pessary, which is most pessaries requires an office fitting with your healthcare provider, but some pessaries that treat stress incontinence are available over the counter. Once inside your vagina, they support the pessary's urethra so that pee doesn't dribbling out. How was a pessary fitted? During your visit, your healthcare provider will fit you the pessary on the day of your appointment. First, they'll perform the pelvic examination. They'll examine your vagina and your pelvic organs closely, the size of your vaginal opening, the length of your vaginal canal, and severity of your prolapse, all playing the role in helping to your pick upping the right pessary. And second, determine the types and size of pessaries what you need. Here, the pessary that is too small may fall out when you use the bathroom. Sometimes, if it is a big one, you feel more uncomfortable. The goal is to find a pessary that is large enough to stay in place but comfortable enough that you don't feel it. And third one is placing the pessary. They'll be gently insert the pessary to ensure your comfort, and you may lubricate pessary so it slides easily. If you are concerned about discomfort, they may apply lidocaine, some lubricant numb to your vaginal opening before the insertion. And final most one, the test the pessaries whether working or not. You may need to stand or sit as quiet or perform the other maneuver to ensure your pessary stays put. Your providers may ask you to cough to check that you are not dribbling. They'll also ask you to empty bladder before you leave, and you should be able to pee with your pessaries in. Insertion of pessary. Hold your pessary firmly between your finger and your thumb and fold it in half. The curved part should be facing the ceiling when you are ready to insert it. It will look like a shape of taco. Here, always wash your hands with soap and water before inserting or when removing your pessary, and make sure your hands are dry before handling your pessary, and wet hands may make slippery and difficult to handle. Sometimes some women find it easiest to inserting the pessary while standing with the one foot up on stool and while the other foot on the ground. Other women's insert the while lying flat on a bed. With more practice, it will get easier. The step 2 is place a small amount of water soluble lubricant on the pessary edge, only that will be inserted into your vagina. Do not cover the whole pessary with lubricant because it will be difficult to hold. You can purchase the lubricant at most of the pharmacies, and some examples are KY jelly or Store Glide and can be used, and do not use Vaselines or any other non-water soluble product. Step 3. Holding the folded pessary in your dominant hand and spread the lips of your vagina part of with your other hand. It is important to spread the lips to sideways motions and not in upward motions, which will only stretch the lips and not help to open in the vagina. Fourth step is gently push the folded pessary, lubricated and first, into the vagina. The pessary should be inserted lengthwise into the vagina, and the vagina is closed area, so it cannot go anywhere else inside the body. Step is to release the pessary once if it is inside. It will unfold and return to its normal shape. And the sixth one is, if it does not feel comfortable, use your index finger to gently push it in a little further, and you can't hurt yourselves on pessaries doing this. The rim of your pessary should sit just under the pubic bone at the front of your vagina. It is okay to be able to feel it with a little with your finger at the opening. You do not need to push it up with the highest it can go. Actually, we want to near the opening to work best. Pessaries will find the proper positions on their own. It is actually hard to do the wrong one. You should not be able to feel discomfort from the pessary once it is properly positioned. How do I remove my pessaries? So first thing is, first wash your hands with the soap and water. Some women find it easiest to remove the pessaries while standing with the one foot up with the stool and while the other foot is in the ground. Other women do this while lying flat on the bed and sitting on the toilet. And with more practice, it will be easiest to learn what works for you. The first step is insert your index finger into your vagina and find the rim of your pessary. It should be just under the pubic bone and front of your vagina. Gently look your finger over the rim of the. Next, tilt your pessary slightly so it is landed little bit, and gently pull down the pessaries until it is out of the vagina. Try to pull a little bit towards the back where the rectum is rather than forward towards your bladder. The next step is bearing down slightly as if you were having bowel movement may helps to push rim the pessaries for you can grasp it more easily. And it is very unlikely that you will hurt yourself pessaries doing this, and you may feel pressure just before as it pessary is coming out. This is normal, and wash your hands and your pessaries with antibacterial water only, and after that store the pessaries in the clean and safe area until you are ready to replace it. Benefits and side effects of using a pessary. Most women finds they are able to successfully use a pessary for 2 years or more without requiring surgery for their condition. There are sometimes mild side effects from pessaries use such as vaginal irritation, foul smelling discharge and urinary tract infections. However, because the pessary is a removal, any side effects experienced can usually be corrected quickly. It is possible to have intercourse with a ring pessary in place, though most women prefer removing it for sexual activity. Care of pessary. The ring pessary is the easiest to take care of your own, and if you have a ring pessary, another type you can remove and reinsert. You can remove and clean it weekly, even nightly. Caring for it is simple. Wash your hands with soap and water and gently pull out the pessary and wash it with the mild soap and water. Rinse and dry it completely before reinserting. And you will need follow-up visits every 6 to 12 months in your provider's office. And during the visit, your provider will examine your vagina to ensure the pessary is it scraping or bruising your vaginal walls, and they'll ensure the pessary still it is perfect working condition. And sometimes if you can't remove the pessary on your own, you will need to see your healthcare providers every 3 to 6 months for cleaning and checkup. When to see a doctor. A pessary can occasionally cause some complications like a foul smelling discharge. This could be a signs of conditions called bacterial vaginosis, which is an imbalance in the natural bacteria found in your vagina, and irritations and even damage inside the vagina. Sometimes bleeding can be seen, and passing a small amount of urine during the exercise or when you sneeze or cough. This is called stress incontinence, and sometimes difficulty having the sexual intercourse, and urinary tract infections frequently. Initial signs of this may be difficult to urinating and feeling unwell, and sometimes high temperature as well. And it is important that you see your doctor if you develop any signs of this complications. They are usually very treatable. Hope this topic very helpful to everyone. Thanks for watching.